And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hello. Welcome to Keeping It 100, where we have these open and honest conversations about health topics that matter to our community. I am your host, Dr. Kristin Motley, and as always, we have a really good show in store for you. Now, during the show, you may think of questions, have comments, just want to say hi. Actually, please say hi. Let us know y'all watching. Dr. Thomas is here. She's going to be keeping an eye on the chat. She's going to make sure your questions and comments are addressed. So give her some love in the chat. Let's welcome in my amazing co-host, Georgie Mink Jr. There you go. There you go.
Here I go. I'm in the building.
In the building.
I'm in the building. Good afternoon, Doc.
Hey, what up?
Hey, just out here, mixing it up in the community and just trying to spread some love.
I feel your energy today. You smiling, you happy. Them kids ain't driving you crazy today.
No, I have my therapist next to me, so it's fine. It's like,
there you go. That's how you do it.
Yeah, I paid for I pay for a therapy sessions alongside my work day, so it's fine.
Mm-hmm. Listen, whatever it takes to get through sometimes.
Right.
It's nothing wrong with that.
Right. I mean, we promoting it, but yeah, Doc, I'm out here. Shout out to Chester, another great night. The festival. Oh man,
the festival from last weekend, right?
It was part 2, homecoming. That's what they was calling it, homecoming 0.20.
Yes.
Love in the city. Just want to keep that energy. Everybody knows who we are, so I hope they checking in today, because all the people that said they know what's going on, they was going to watch. I'm like, okay, so we should have like 1,000 views.
Yes.
But I don't know. People were drinking and stuff, so I don't know.
Oh, but we're gonna find out. We're gonna see who watching, who learning, who's getting a little bit better.
Nah, but we getting some good feedback from the community. A lot of people love what we doing, spreading the message in our language and from our folks. So we getting it direct. I've still been going to barbershops as well after my day, and brothers still on the bubble about these vaccinations. So.
Listen, I'm not mad at them. I'm not mad at them. It is not an easy decision to make. And that's why we do this, because so that people can have a different perspective. A lot of times when all that you hear is the way that you feel and you don't hear any other perspective, it's hard to make a solid decision, because you and your friends and your family are all kind of saying the same thing, and that's not always helpful. You want to get another perspective so you can consider it and determine which makes the most sense to you. And it's hard to do that, especially in a healthcare space, especially when politics is involved and when the government is involved, and these are entities that you have a poor history with. So I get it. It's not an easy decision, but that's why we do what we do. Yeah.
I mean, a question did come up about the kids. What's going on with the kids with the I forgot what it's called, that fast.
RSV.
Yes. So
yeah, like RSV. Yeah. So we're going to do an RSV show.
Some guy brought that up to me, told me to mention that on the show, and I said we was going to give it a little bit of time today. He said I think his niece came down with it.
Okay.
And she was very, very, very sick. And he wanted to know, was it a vaccine for it?
That's a good question.
Yeah.
So RSV is a respiratory virus, is very, very common. It's not something that's new. We're hearing about it more because we have been protected from a lot of the respiratory viruses and colds and things for the last 2 years because we've been wearing masks. So now that we're not wearing masks anymore, these viruses are playing catch up. They like, oh, we back. We outside. And so now that a lot of the protections for COVID have gone down, now the regular viruses that have always been in circulation are just like coming back with a vengeance. And so RSV is not new. In fact, Noah had it in June when he started daycare. So he started on a Tuesday. He went Tuesday, Wednesday, Thursday. By Saturday, he had a fever, 103. He wasn't talking and he wasn't eating. And this was in June. So it wasn't even expected for him to have RSV because it's usually spread in the fall and in the winter months like now. And so his pediatrician was surprised about it, but it's a respiratory virus that mostly affects toddlers. So you usually get it when you go to daycare, you putting stuff in your mouth and y'all coughing and y'all sneezing all over the place and not covering up because you're a child and you just don't know any better and you don't know how to cover your mouth when you cough and you just being a kid and putting stuff in your mouth. And so it's very common in toddlers and in small children. And in some children, especially if you're really young, like less than 6 months, like a small infant, you can get really, really sick. Like they shut down ICUs when kids have RSV. It's a big deal because kids get really sick because if they don't consume enough fluids, then they could become dehydrated and dehydration can cause them to die. So the most important thing, one of the most important things with RSV is to make sure your child is drinking fluids. And we're going to do a show on this next week to just kind of talk about it a little more. But the main thing is to make sure that the child is staying well hydrated because it is usually the dehydration that leads to the problems and where you have to take the kids to the hospital. The common symptoms are they're like cold symptoms. So you may have a cough, you may have a runny nose, you may have a fever, and it can be mild, but for some kids it can be severe. There is no vaccine for it yet. Now there are a few that have been in the works for a while. I think they're being reviewed by the FDA, and Dr. Thomas can check on this. I think they're under review, or the drug companies will be submitting their application soon, but there's none approved yet. And this isn't going to be a fast track thing like COVID vaccines were because they have been studying this for years because it's been a problem for years. So it's not going to be something that it just came up in a year and, they have a new vaccine for it. It'll be a new vaccine, but it went through the traditional long process of testing it and trying it that we are used to with vaccines. So those are the main things I can think of in terms of RSV. I know a lot of the children's hospitals are full of kids with RSV right now, and it's just really unfortunate. And just if your child has a cold or anything, and if it appears to be severe, get them to the doctors. The doctors can do a test right in the office and tell if they have RSV. And there's no treatment. You just have to manage the symptoms. So if they have a fever, then you give Tylenol or Motrin. If they have a cough, then you do things. But we'll talk about that more next week.
Okay. Good stuff.
Cheer. How was Trunk or Treat?
Oh, that's what I meant to say. Shout out to the Infinite Men of Honor. Great night. C's was the host. We was the co-host. Yeah, he was Michael Jackson, and we was the brothers.
Oh wow.
But it was a nice, great turnout. I was Freddy Krueger out there.
Ooh,
having dreams and nightmares. Yeah, I had a great night. Yeah, it was fun. Shout out to the city. We showed up again. That's all part of community involvement and just keep transforming the energy to the next event, to the streets, to the hallways, to the houses, to everywhere we can be. So yeah, it was a great night. I
From
had
the
about 6
hallways to
flyers
the
left.
houses.
Yeah, I
Huh?
had about 6 flyers left. I gave them out, Doc.
Listen, I
So
know you put in your order for
yeah,
flyers. I
right.
got you. Don't put my business out on the street
I
that
know.
I'm
I'm sorry, y'all,
getting
but
you your
it's
supply.
like right.
I'm gonna re-up your stash.
Okay.
Don't worry. I
But
got you.
no, great night, Doc. Great night. Great feedback. Just more positive things to keep going on, and just keep connecting with organizations and brothers and people in the community. It's just a wonderful thing. And we didn't
Awesome.
even get rained out, so we sold out. We was out of candy in like
Oh
I think
wow.
an hour and a half, and I mean we had mounds of candy. I might have
Wow.
to call Nestle or somebody or Hershey next year and see if we can get an endorsement. Because
Can we get a sponsorship,
yeah,
please?
we might have to get yeah, we need some of that for next year. But nah, it was a great night, Doc. Great night.
That's awesome. I'm really glad to hear that. Good job for doing that.
Mhm.
And my hat goes off to you and the crew for putting such a thing together and just being, a um, positive Black men in the Chester community. I think that, that's really important for our young guys to see. And so, y'all keep doing what y'all doing. Men of
Right,
honor.
right.
Love
Wow.
it. Love
Yeah.
it. Love it.
Shout out to P. P. That's Pete Dill. So he came up with the concept, and we just continuing with the progress and the process. So
Good
yeah.
job. Good
Hmm.
job with that. Now, you had said something, hallways to homes or something. I like that. I
Yeah.
think we can do something with that. Hallways to
Yeah.
homes. So that's good. That's good. Good, good.
Yeah. That's where we at. I mean, because I'm in the hallways. I'm in the
Yeah.
streets.
Yeah. I like
I'm
that.
on Steve Harvey time now with Nasir.
You got 10 jobs.
I'm working with Nasir. Shout out to Nasir, that brother everywhere. So
Mr. Leach.
yeah,
That's
yeah,
awesome. That's
yeah.
great. That's great. I want to go back to homecoming. I want to acknowledge and shout out everybody that came through our vaccine clinic at homecoming. We put 32 shots in arms that day, which is awesome, between the COVID vaccine and flu shots. I want to remind everybody you can get both at the same time. Me, Bria, and Bilal, my husband and daughter, all three of us got our flu shot, our COVID shot. There was no problems. Like it's all good. You can get them both. You're encouraged to get them both just to save you time. It's just convenient. So get your new COVID booster. And when I say new COVID, I mean the new. A lot of people say that they got the booster, but then when I ask them when, they say, "Oh, I got it in March or June," but there is a new booster. It came out in September, and this is the bivalent booster that provides protection against Omicron. That's the one that's mainly in circulation right now. There are some other ones. There are some other variants coming through, but still Omicron is leading the way. So we want to get protection and get the new booster. So if you haven't gotten a vaccine recently, make sure you go in and get your new booster. Get it from any pharmacy. We are doing Chester High School basketball game, the first game of the season. We'll be doing a COVID vaccine clinic there. So we'll have vaccines and boosters. I think that's December 2nd or 3rd. I have to check. But we'll be back there. So if you want to get it from us, you can come through. Yeah, there's a new booster. Get the new one. And if you haven't had one shot yet, get your first shot too. If you have questions, let us know. We got you. I know it's not an easy decision, but we're trying to move past this, and we need everybody to cooperate.
Mm-hmm. Mm-hmm.
I want to mention real quick that I know we have a guest coming on. Oh wait, she's here. So let me bring her in. Dr. Williams. Hey, girl. I'm going to say Dr. Williams because why not?
Right.
Dr. Williams. I know. Almost Dr. Williams. I know.
Right. Welcome back. Welcome back.
Welcome back. Absolutely. So just want to welcome almost Dr. Shauna Williams, who is the founder of SW Doula. She provides integrative doula support, lactation care, and clinical counseling services to individuals and families related to childbirth. She is currently a PhD candidate in social work And her research focuses on Black women, maternal infant health outcomes, pregnancy after loss, and the impact of historical trauma. She already know I need to be at that dissertation so I can just fill myself up with knowledge because that's deep. So welcome back, almost Dr. Shauna Williams. Thanks for being here.
Thank you for having me today.
Yeah, of course, of course. So we are going to be talking about maternal mortality, particularly Black maternal mortality, which is a topic that I really didn't know was a thing until recently. And it's a big thing that everybody should be knowing about and should be talking about. And so that's why we are here today. So first, I just want to set the stage and ask you, can you define what is maternal mortality? Like, what does that even mean?
Yeah, so maternal mortality is defined by the CDC as the death of a woman from pregnancy-related causes during pregnancy or shortly after birth. And that time after birth is usually up to a year. There's been some recent changes around that, but about a year after birth.
Okay. So I was reading recently. So this is when the mother dies within a year of having the baby. Now, could this happen before she has the baby too?
Yes.
Okay. Okay. So while pregnant or within a year of having the baby, that's counted as maternal mortality. Got that. Now, I was reading recently, which is really interesting because I hadn't seen a lot on this topic, but that maternal mortality rates rose since COVID, which is a bit, a lot of things have happened since COVID, and we just don't need any more help in Black women dying, but COVID has seemed to do that. One of the articles that I saw had said that the increase from white women was 18 to 26 deaths per 100,000 live births, but for Black women, it rose from 44 to 69. Like we was already more than 3 times higher. Now we're like pushing on 4 times higher through COVID, which is insane. Like we did not need help killing more Black women. And so it's just sad. This is a really sad statistic. Have you seen anything related to maternal mortality and COVID?
I have, and I hate to say this, but many people doing birth work and working with, particularly around issues of maternal mortality in Black women or in marginalized communities, we expected that this would be the outcome. And part of that is because what we know about maternal mortality, of course, it can be certainly related to pregnancy complications and the impact of pregnancy on the body. But it is very clear, particularly as we look at Black women, that it is related to systemic racism. And that's happening in the medical system.
Yeah.
And the way that the bias has been institutionalized and it's unconscious, we knew that under stress, which was happening during COVID,
Wow.
and less eyes being in the room, even additional family members and things like that, we knew that that sort of stressor on the system had that potential outcome.
That makes a lot of sense. That makes a lot of sense. So it sounds like the government and some other entities need to put some resources behind helping with these like issues, especially when it's a problem without the stress.
Right.
And when you bring in the stressors, you know that that's just going to extrapolate. So it sounds like we need, tons of resources behind this to address the current issues through COVID, because we're still experiencing that, and healthcare workers are still stressed, and we need them to pay more attention to Black moms. And so we kind of want to bring the numbers back to the normal and then attack what the normal was, because the normal numbers were a problem already. So it sounds like lots of opportunity to do a lot of work.
Absolutely. like you said, before COVID, the United States was already noted as one of the worst developed nations as it relates to the maternal mortality rate in general. And there was advocacy around and a response to Black maternal mortality rate, the Black maternal mortality rates being viewed by the International Human Rights Commission as a human rights crisis.
Yeah.
And so we really have a lot of work to do. And then on top of it, a worldwide trauma like COVID really impacted an already stressed system.
Yeah.
And if we also add, when Black women hear these sort of statistics and these stories, they often assume being Black is what's dangerous. And unfortunately, I hear that being kind of supported in some of the ways that healthcare providers talk to people about these issues. So for example, I had a client who was told to take a medication, and she called me as her doula and was saying, "What do you think about this?" And I asked her, "Why did your OB say you needed to take this medication?" And she said, something about me being Black. And I was like, "Well, what is the medication going to do to your melanin? I don't understand."
Right.
But what I believe was happening was she had read a study about the provider had read a study about seeing outcomes that are positive related to this intervention with Black women. But often what these studies are leaving out is that it is not being Black that's the problem.
Yeah.
Systemic racism that is the problem.
Is there anything else fueling these issues aside from the biases and the systemic racism, the structural racism? Like, could there be anything else that is, say, influencing these outcomes?
Yes. So when we look at it from a framework of reproductive justice, which looks at a holistic view of the right to have children or not have children, and to have those children and families in a safe community and environment. And we also think about the life course perspective, which says we can't just start when someone gets pregnant. We need to be thinking about when that baby is developing in utero, they're going to be someone who's going to reproduce. And so we need to be thinking at that point about how do we address some of these issues. When we think about it from those perspectives, we know that there are significant challenges that we face in the environment as Black folks where we live, environmental racism. There's a lot of pollutants and things that we are exposed to in our food, air, and water that more significantly impact Black and Brown communities. There are things related to comprehensive sex education and people understanding around their own taking care of themselves and nutrition, around what food and what things are available to them in their communities, contraceptive access and how they're able to use or get access to contraception, community violence, and even things like police brutality. There's been interesting studies about communities where there is high rates of racially based police brutality. We see higher rates of Black maternal mortality and Black mortality. So there is a lot of systemic issues, environmental issues, and things that are happening before someone is even thinking about having a baby. But many of those issues are grounded in the history of historical trauma and systemic racism in this country. It doesn't mean that it's as simple as just saying, well, it's racism to fix it, right? It's about our own response as a community, as families, as individuals, but it's also about acknowledging and making real changes and improvements to the experience that we have just as Black people surviving in the United States.
Wow.
Well, I just had to say, as far as the deaths, why is it a year after? And how is it not connected to postpartum?
So that's a good question. So we consider postpartum a year after birth. So it is related to that time period. But part of the reason why there actually was a push to expand beyond what the initial review was. So initially we were looking at during pregnancy or 42 days after birth was the only way things were getting captured as maternal mortality.
Wow.
But what we know is that Health complications, your body's way of responding to pregnancy, and your ongoing medical care after pregnancy. Those initial impacts can be up to a year and probably a little longer, that we're going to still see some of those things happening. And so I wanted to really there is a person who died recently, and when their name comes to me, I will say their name correctly. They passed away from a heart condition close to a year after birth. And their death was not considered an issue of Black maternal mortality. But what we know is that pregnancy can negatively impact heart function, and that she already came in with a condition, right? Which many of us as African Americans are at a higher rate of many health disparities. So during pregnancy, that condition was aggravated and most likely then contributed to the condition of her heart, which then contributed to her death, right? So, but if we disregard that and say, well, she just had a heart issue, then we're not really looking at the ways in which there could have been care really provided and targeted around the impacts of pregnancy on the heart that could have prevented her death.
And that's important, because if we're not capturing that data, then it's not coming up as a problem. And if it's not coming up as a problem, then we can't put any strategies together to address it. And so that is a huge issue. I remember when I had Bria, she's 11 now, I had heart palpitations throughout my pregnancy. And this is way before I even knew anything about maternal mortality, which might be okay, because I probably would have stressed out the whole time. Because my provider was not Black. And what we do know is that when Black women have Black providers, the outcomes are much better, but that's another topic. I had heart palpitations, and I was on medication throughout my pregnancy. And then when she was delivered, I didn't have them anymore. But about 3 or 4 weeks after Bria was born, my ankle started to swell up, and it did not make any sense because I hadn't been in a hospital for like almost a month. So I called the doctor, and she said it was normal. And I just said, okay, because I don't know. I had never had a baby before. But that just makes me think that it could have been something else, and I would not have known any better. And I could have, passed away, and just, because I just didn't know, to really be paying attention to my body and to my symptoms after I had a baby. So that's really scary. So I'm really looking forward to doing more work in this area and just trying to promote the education around this, because it's missing.
Absolutely. And to add to that, your provider should have been more involved around your care after you had your baby, right? Knowing that you were exhibiting these symptoms. And when someone who has had a baby and their baby is 8, 9, 10 months old, and they present to the emergency room, people aren't necessarily asking, did you have a baby recently?
Yeah, no, they're not.
So, and that can impact how your body's going to respond to medication, the type of support you need, even your ability to be able to really follow medical advice is impacted by that. If I am a single parent and I'm in the hospital for a medical condition, the likelihood that I'm going to be able to stay for a significant amount of time or not want to sign myself out or come home and actually be able to follow the treatment regimen, if I'm the only person caring for my child, is impacted.
Yeah. This is tough, man. This is tough. One other question I wanted to ask is the role of a woman's mental health. Are there any correlations between like previous behavioral health challenges and maternal mortality? Is there any correlation?
Yeah, that's a great question. So what we know about, particularly with Black women, is that Black women are at a significantly have a higher incident of perinatal mental health, mood and anxiety disorders, and they are less likely to be properly diagnosed, less likely to properly receive treatment. And there's a lot of factors around that. But one of the outcomes of what we know, and also how is this research being captured, one of the leading causes of death for women in the postpartum period is suicide.
Wow.
And so are those numbers always being captured in the Black maternal mortality rate? I honestly cannot answer that question. I know that we are aware that this is an issue across races, that suicide is a real risk. But when we already think about people who are not being assessed
Yeah.
or treated properly, they're at increased risk. And
Wow.
again, let me say, we no longer say postpartum mood and anxiety disorders. We say perinatal.
Okay.
Because those symptoms can appear very early into the pregnancy. I have seen moms as early as 6 weeks pregnant saying, I am having suicidal thoughts.
Wow.
Before then. There is some correlation between previously being diagnosed with a mental health disorder and then becoming pregnant. It does mean that people need to be monitoring you a little more closely, being more thoughtful around altering medication regimens, putting that support in place early because those symptoms can appear early. And really, perinatal mood and anxiety disorders are very treatable. And so it's unfortunate that that's an outcome, because when parents get what they need, we can really reduce those numbers.
Yeah. Yeah. Wow. This is really good. Now, I know you mentioned perinatal and postpartum. I just wanted to ask you to define those for the audience, please.
Yes. Perinatal means the process of being pregnant, or should I say becoming pregnant, because we think about people who are dealing with fertility treatment as being part of the perinatal mood and anxiety disorder potential population. So trying to become pregnant, being pregnant, and the postpartum period. We'll say up to a year, although there is some folks who will say the World Health Organization says up to 2 years. And some people are like, we should probably push that a little farther because those first 3 years are a lot. But that entire time period is considered the perinatal period.
Okay.
And that's when providers should be, mental health and physical health providers should be thinking about your experience of becoming pregnant, being pregnant, and having a baby, and the after effects on your mental and physical health when they are treating you in any sort of way. And even when like social service providers are involved with you, we should be thinking about these families as they're in the perinatal period and they have unique dynamics that deserve additional attention.
Wow.
Thank you.
What quick question. What is the most common way of the death? Like, how do they leave here? Like, what way are women dying?
So when you're thinking about physical health issues.
Yes. I mean, like, how does it contribute to the cause of death?
So most often what we're seeing is things related to blood pressure and the cardiovascular system. But there are a variety of pregnancy complications that can come up, but many of them are in that category of what we're looking at.
Wow.
I thought that was a good question too, because I was wondering that too. And G, I know you had a question about partners.
Oh yeah, like I mean, we watched the documentary. I forgot what's the name of the documentary doc that we watched.
Massive Shock.
Yeah, so I watched that and I was like blown away because it was like men, who were spouses of the women that passed away due to this. And it's actually the first time that I'm hearing about it. And it was just like, what about like the support group, like for the men, and what should we know as mates about this? Like, what can I pass on if I start talking to some of my brothers in the barbershops or whatever? Like, what information could I give to them regarding these situations?
Yeah, that is what I loved about the documentary, because we don't hear about what happens to partners and grandparents.
Mm-hmm.
And the children left behind, we often don't hear about them. And so really thinking about them is something that I wish we did more of. I wish we could say that there are really well-known, significant support groups out there for dads. And there is an increase in that, but it's really not as prominent as it should be. Wow. One of the things that was so special about what we saw in Aftershock was we saw those Black fathers connecting with one another and supporting one another. And what I think is so important about Black men in particular being and supporting one another is because there certainly is mistreatment and there certainly is medical causes related to maternal mortality in general that a partner has to think about and reflect on after their partner dies. But with Black families, the difference, and this is why in my practice I specialize in working with Black families, because we also have those experiences of microaggressions or macroaggressions related to racism. That's a part of what's happening. So, for example, I am hearing from some of the Black fathers that I'm working with that there are questions about what their relationship is to their partner. They're not being included in the conversations during pregnancy care. They are not offered any sort of support. The childbirth education that is offered is often directed only at the person giving birth, not at the partner. And medical providers might not be treating them with respect or offering them any sort of real engagement. Their behaviors might be viewed as aggressive and they might be dismissed more frequently. I've even seen experiences where fathers are trying to offer support through like spiritual support. I've seen a father who was praying with his spouse and the medical staff disrupted that and said, we don't have time for that. So those sort of things are happening. And then if you lose your partner, that's a part of your pain and grief process. And that's not something that in spaces where it is not centered around Black folks, when you bring that up, you get people saying, well, that's not racism. That happened to me too. Or well, how do you know it's oh, we got to play the race card.
Mm-hmm.
Time for that when I'm grieving. I need somebody who can hear my experience, get where I'm coming from, and offer support. And often a lot of the families that I work with are like, do we need to pursue this legally to go after?
Wow.
We need to rally around this, right? And so I think that Black fathers being able to come together is so important. Another thing I love about the term perinatal versus postpartum is that it includes everyone who is involved in a baby coming to a family, not just the person who gave birth. Postpartum is kind of talking about that person who gave birth. Fathers are in the perinatal period too.
Mm-hmm.
We're looking at perinatal mood and anxiety disorders also as it relates to fathers. And so providers in general, mental health providers, social service providers, physical health providers, we need to make sure dads are involved and present. So some of the things that I tell the dads that I work with, for example, I've had women who are bringing up concerns to their medical provider and the medical provider doesn't seem to be responding or is disrespectful or dismissive. And I tell those dads, you need to go in that, you need to be there. You need to be in that appointment.
Mm-hmm. Mm-hmm.
One of the things that happened during COVID was they weren't allowing dads in.
Yeah.
Only the person who was giving birth. And so I was talking to moms about, well, you need to say my partner is going to be on FaceTime.
Yeah.
Or my partner, there's no secrets here. Why are you, they're not allowed to get access to this information? They should be able to ask questions too.
Yeah, that's good.
I've had experiences where I've seen women advocating for things like, can I get a doctor's note related to having my duties changed at work? There was recently an experience of mistreatment that happened that went viral at a hospital in the Philly area about a mom requesting this and had a nurse become really physically and verbally aggressive with her because she was saying, I'm in pain. I'm asking the doctor for a note to reduce my duties at work. I had
a simple request that doesn't have anything to do with you. So why do you care? Why do you care, nurse? Like,
yeah, many OBs were like, we write that all the time. Why was this nurse having an issue? Right? The nurse had an issue because she believed that that Black woman was lying.
Yeah.
Wow.
Well, I had a client who had a similar experience. The doctor hadn't been as aggressive, of course, but was basically like, no, I think you're fine. No, you're okay. And I told the father, go to that appointment. And when you go in there, you say, I have concerns. Say, our doula has concerns and I've been talking with her and we feel this is what's best. And you don't need, not even being aggressive. He's a very laid back guy, but just him showing up and making the request that doctor that day.
Wow.
That's
crazy. I'll be looking for a new provider because I just have a low tolerance for stuff like that. This is just a lot. Now I know that Dr. Thomas had a few questions for you too, so I wanted to give her opportunity to ask. Dr. Thomas. I think she can, but I know one of her questions was about the disparity between the Black women and providers, and is there differences based on income? Like, is this a thing that just happens to poor people?
That's a real good question, because what's interesting is we know that Black women who are married, have a higher level of education, have good health insurance, they're actually more likely to have challenges with maternal mortality and morbidity. Their rate is higher than a white woman who has a GED, is unmarried, and unemployed.
Wow.
So this is why we know for certain that this is about racism. It's not about money.
That is crazy. You better know your facts and statistics, almost Dr. Williams. Yes, because that matters. Like, to know that tells the story. It absolutely tells the story.
Mm-hmm.
Yes, and the interactions between Black women and providers, there is a difference. And there is a really wonderful book called Black Women Birthing Justice. And they did a study really looking at Black women's experiences with providers, and they found significantly higher rates of feeling mistreated, feeling disrespected, being dismissed, that Black women were reporting. And as a doula, one of the amazing things I get to do is I can be in the room, or I can request, right, if you want me to be in the room with you during your appointments. And I also I check in with a client right after their appointment. And I will tell you, I do specialize in working with Black women, but my specific specialty is pregnancy after loss. And because there's not necessarily a lot of people who specialize in that, I do have white clients who say, can I work with you, just because I'm dealing with that experience and no one else has a specialty.
Yeah.
There is a distinct difference, even at the very same hospital, in the way that my Black clients are offered options, are treated, and are engaged, that is different from white providers. And it's not about being nice.
Yeah.
Because they might go to a hospital where everybody's nice.
Yeah.
My husband often uses the term, right, we are allured by he uses a better term than what I'm about to say, but like the banality of evil, or like the pleasant evil. Right? No, it might not be a doctor yelling at you.
Yeah.
But they just might not offer you the same options.
Yeah.
They might not tell you the same things. In a very pleasant voice, they might come in and say, well, if you don't do this, you know your baby's going to die. And honestly, that is how they would speak to you in the room. And they may not say that same thing.
Yeah.
I have seen white women demand things that I am shocked every day. I'm like, how did you get them to do that?
Wow.
Just because they asked for it and they demanded it. And I don't want to make this about, well, Black women don't ask for those things or demand those things, because that's not true. But sometimes when we do, it's viewed as we're being aggressive.
Or you're lying.
Disrespectful, we're lying.
Yeah.
And that is the part of it that is really institutionalized, because what I've heard white women who care a lot about this subject, and they say, well, Black women have to take responsibility too. They have to speak up more, and they have to get educated more, and they have to stand up for themselves. And I'm like, and when we do, they don't listen either.
We the angry Black woman.
Exactly.
Oh, this is a lot. I have so many more questions. You done opened up so many more topics. So we got to have you back. This was really, really, really good, Shauna. Thank you so much for being here. And I want to encourage everybody to check out Aftershock. It's a documentary. It will blow your mind when you learn the impact of racism on Black maternal mortality, and just to learn about the topic in general, and what is happening here in the US that's not happening at other places around the world. We are doing a film screening. So Shauna and I are on a planning committee with the Foundation for Delaware County. We're hosting a film screening of Aftershock at Widener on December 2nd. It is open to the public, and I'll make sure you all get the link to register. It's a free event. So we want y'all to come and check that out. Shauna's going to host a panel discussion, which is going to be amazing. So we'll talk about that more as it gets closer, but it'll be here before we know it. So thank you again for coming on the show. Before we close out, just want to remind y'all to get your new COVID booster, the new. If you haven't, if you have questions, just reach out. Always glad to help. And we will see y'all next week. We're going to talk about RSV.
Thanks, Sean. All right, Doc, have a good one.
All right. Bye.
Uh,
And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I need.